let's start. Hi, this video is the art of hair transplant restoration surgery on a woman who had a receding hairline and corner, and because of the facelift procedure, sometimes it causes hair loss and raising up slowly. So if you can turn this way, and that's one side effect of facelift, but it rises up so slow that it's hard for people to see sometimes. And when you pull your hair up, that's you can see the difference. And so what my goal is to do is to recreate the hairline, and actually she healed very well. And if you can turn this way too. So we not only lower the hairline, but we're gonna bring the tempo in, because if we don't lower the hair, if we don't bring the tempo in and just lower the hairline alone, then the forehead can be too wide, and they will bring out it's not symmetrical. Hairline, especially for women, is an art form. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. We gotta make sure we bring it that lower hairline, make the forehead smaller, and bring to the symmetry of the face to a third and a third and a third. And once you do that with a lower hairline and a full set of hair, it really brings out the eyes and nose and all the features that God created for you. So the shape is, on average, from the mid eyebrow to the hairline, is around 4.5 to 6 centimeter. And then once we get at the average height, and then from the midpoint to the sides, it's around 6 to 8 centimeter. That's the average where we're talking about. And again, once the tempo for men, especially Caucasian men, the angle of the tempo pointed backward. Asian men angle less, and black men actually perpendicular. But for women, the angle is not straight backward or up, but actually pointed toward the middle. So the angle of the tempo is very important. And once we get the shape down, we would be transplant at a very precise angle of 35-45 in the front, increases when you go backward, and changes when you go different direction. And then the selection of hair graft is important. Why? Because you don't want thick hair graft here. So we transplant rows and rows of single hair graft in the front, followed by roots that grow 2 hair, 3 hair, and 4 hair in the back for bulk and volume. If we use roots that grow 2, 3, or 4 hair, it looks too harsh and pluggy, and it will lead to detectability. So we will transplant a lot of rows of single baby hair graft in the front, and especially the temple. And again, the angle of the temple is important. Unlike the front where it goes straight 45 here, it's flat against the skin and pointed backward. And the temple require a lot more baby hair and backward. And so with my work, you would not be able to detect a hair transplant was done, as if I was never there. And I'm very excited for this young lady, because you know, once a year later, she's already a beautiful woman, but once we have the hairline down, it will really going to enhance her eyes and her nose and all the features that God created for her. So hopefully she'll come back, and we'll do another filming for a follow-up for her. Thank you.